Pre-diabetes. The goals of learning are to understand what is prediabetes, who gets prediabetes, why is the diagnosis of prediabetes so important. Then the question I always get from people who have prediabetes, they always ask, should I take any medicines if I have prediabetes? Last but not the least, we will learn that can prediabetes be cured? Now let's see what is prediabetes. If a blood sugar or blood glucose reading is between 100 and 125 milligram percent, it is called prediabetes. So if the reading is 100, 101, 105, 120, 125, all those readings indicate prediabetes. This was the fasting blood sugar. If the fasting blood sugar is above 125 milligram percent, we know it is diabetes, and if it is below 100 milligram percent, we know it's normal blood sugar. There's another way to come to the conclusion of a diagnosis of prediabetes, and that is by giving 75 gram glucose to the patient to drink and check the blood sugar or blood glucose levels after 2 hours, and if they are above 140 milligram percent, then it is prediabetes. Now let's see what is the relationship between blood sugar and insulin. The red one is the blood sugar. Here it shows like 75, and the blue one is insulin. This is 7 o'clock in the morning. The person eats breakfast. This is a graph from a normal person who does not have diabetes, and it's courtesy of Wikipedia. So when the person eats breakfast, the blood sugars levels go up, and when the blood sugar levels go up, insulin levels also rise. This insulin helps to decrease blood sugar levels back to normal, and in a moment we will see that how does that happen. But after about 2 hours of eating the meal, between here and here, we see the levels have come back in the normal range. Now what happens when there is lack of insulin? That this level, the fasting level, is higher somewhere here, and the peak level that is reached is much higher, and the peak level does not come back to normal in 2 hours time. In diabetes, this level is above 125. In prediabetes, it is between 100 and 125, and 2 hour level in diabetes is above 140, and in prediabetes above 120. So what happens in prediabetes? There is still insulin available in the body. The body can still make some insulin, and as a result the levels don't go as high as in diabetes and come back more towards normal as compared to diabetes. So there is a relative lack of insulin that causes this picture. Now let's see how does insulin help decrease blood glucose levels. This is an artery which has blood sugar or blood glucose in it, which came from the carbs or carbohydrates that we ate. This glucose need to enter the cell. This is a cell, and cell is the smallest unit of body. it is so small that we need microscope to see it. Each gram of our tissue can have hundreds of millions of cells. So this glucose need to enter the cell so that the cell can do its function. So the brain can think, so the heart can beat, the liver can make enzymes to digest food, and so on and so forth. Entry of this glucose from blood into the cell is helped by something called insulin, which opens like doors of this cell wall for the glucose to enter. When there is relative or total absence of insulin, the glucose cannot enter the cell and the levels rise in the blood. When the fasting levels in the blood reach between 100 and 125, it is prediabetes. When they cross 125, it is diabetes. The insulin comes from pancreas, and different problems with pancreas can cause decrease or absence of insulin, and we have discussed these in the presentation called types of diabetes, which discusses various types of diabetes. But suffice it to understand here that if there is moderate lack of insulin, then the levels will rise, but probably not as much to cause the fasting sugar to cross 126 milligram percent, but probably sufficient that the blood glucose or blood sugar will rise to between 100 to 125 milligram when in the fasting state. Now this is an important diagram which I will like you to understand, because when we talk about what a pre-diabetic should do to minimize getting problems from pre-diabetes or diabetes, this diagram will be important. The brown line, continuous line, shows the food eaten, a regular food that is eaten, and the blue line is the insulin that is released. The dotted line on the other hand shows a food which has high glycemic index, a food which suddenly increases the sugar values. And since this picture is from a person who does not have diabetes, the pancreas immediately pumps a lot of insulin and the levels come back to normal. Now what will happen if the patient has pre-diabetes or diabetes is that these levels will rise much higher and will stay there for a long time, because there is not sufficient power in pancreas to release that much insulin. So the pancreas may release that insulin gradually and the levels will come back down to normal gradually, and the time during which the levels remain high, that puts the patient at risk for complications from diabetes. And that is why it is said that if you have pre-diabetes or diabetes, you should not eat foods that can suddenly increase your blood sugar level or blood glucose level. Now who gets pre-diabetes? Risk factors for pre-diabetes are the same as those for diabetes. They are discussed in detail in our presentation called Introduction to Diabetes, but I will summarize them here. Persons from certain racial backgrounds have higher incidence of diabetes. Persons who have a family history of diabetes have higher incidence of prediabetes and diabetes. Persons who are inactive, sedentary, or overweight have higher incidence of prediabetes and diabetes, and we will discuss about that when we talk about what a prediabetic should do in daily life. Then persons whose bad cholesterol is high, bad cholesterol is called LDL. If it is high, then those people have more chances of diabetes. Those patients whose HDL or good cholesterol is low also have high incidence of diabetes. Patients whose triglycerides levels are high are also at increased risk of prediabetes and diabetes. All these factors, the high bad cholesterol, the low good cholesterol, obesity, inactivity, they probably are bound together. The common underlying factor there is lack of activity, and lack of activity decreases the function of insulin available in our body.